Infection in early pregnancy indicates genital tract infection in upper layers is distinct in pregnant when compared to non-pregnant women. Women who suffer from pelvic inflammatory disease are encountering difficulty when they become pregnant, suffering from acute infection in the uterus tracts, which is the process of interfering with the processes of fertilization and implantation of the ovum, which is the reputation of establishing pelvic inflammatory disease, which results in scarring, ectopic pregnancy, as well as infertility. These infections do occur in development stages during the process of pregnancy itself. Because of some events which indulge in disruption of the body's defense instincts which are normal in nature. Spontaneous or induced abortion is surmounted by problems of complications of early pregnancy, which are related to these symptoms. Spontaneous abortion or miscarriage is a common phenomenon in the first trimester, when you are prone to high risk of infection if it is performed in unsafe postulations and conditions. These abortions are incomplete when the tissue is embedded in the uterus and the infection has probabilities for development in the remaining products of conception, which should be removed, otherwise it will expose infectious conditions. These details do not come to surface whenever medical care and attention is sought after for combating complications relating to abortion. Women who encounter problems following induced abortion may not give a passing reference adopted in this regard. These conditions are with a writer when abortion is tainted with illegality. People may simply allege complaints with regard to spontaneous bleeding or other problems in this regard. You are cajoled to harbor a higher degree of suspicion and manage a possible infection without following abortion, triggered by objective signs with reckless disregard to the history or the background. The treatment of abortion complications includes stabilization of the patient with regard to his or her history by the removal of the residuary products of conception from the uterus, which also involves administration of intravenous intramuscular antibiotics. These complications can be life-threatening as well as overimposing without losing track of timely assessment, as well as its managements, which are critical or near hypercritical. All women who are suffering from signs of shock of infection in early pregnancy stages should also be administered a facility that can provide technologies as well as methodologies of management, which may inter alia include safe evacuation of the contents of the uterine tract. There are ample chances of bleeding in early pregnancy stages, which may indicate the threatening process of abortion, which is either in progress or incomplete, or may develop a sign of ectopic pregnancy or development of some other problem instead. The signals of incomplete abortion are indicative of a soft as well as enlarged uterus and open cervical tract. Sometimes abdominal pain precedes or follows at the same time, along with the abortion involving post-abortion infection, as well as ectopic pregnancy. The signal of ectopic pregnancy is not indicative when bleeding occurs otherwise with severe pain, it is indicative with prevalent conditions. To conclude, infection in early pregnancy should be avoided by taking all possible precautions by also adopting methodologies to be devoid of any bleeding problems, with an emphasis on proper hygienic conditions, as well as getting signs of ectopic pregnancy or the development of some problems, which should be immediately set at rest. These methodologies are important for absolute safety in handling abortions with attendant or non-attendant infections, which are important for the purposes of protection of the mother, as well as the young one's life, which are precious. For this purpose you have to follow the best technology which is available all over the world with latest practices which evolve varieties of nuances for the purposes of development of this as a technology-given process for the well-being of one and all, including becoming the linchpin, has the hallmark of medical science.